Hey, if you've been told your MRI is normal, or maybe you have a little worn out disc, a little degenerative disc, maybe a little arthritis in there, but there really is nothing to worry about, but you're still hurt, you're still in pain, you're confused. More importantly, you're frustrated, right? Well, you're not alone, and it's not your fault. Today, I'm going to show you what's actually happening, what's causing your pain. That's what I'm going to tell you, what's really the cause of your pain. And that's so important because chronic pain is a totally different animal than acute pain. Chronic pain is when the normal healing time for whatever you injured has come and gone. Like if you fracture a bone, you're typically thinking 6 to 8 weeks for the fracture. Okay, well, what happens if you're still in pain after 8 weeks or 10 weeks? And I see this so often with patients coming back from having spinal decompression for disc problems or what they thought was a disc problem, low back pain, or post-surgical pain. There was shoulder surgery, knee surgery, lumbar spine surgery, and yet the patients are still in pain after all these weeks of therapy. Why is that? Have you ever thought about that? Have you ever wondered, why am I still in pain after all this time? And I bet you're not getting answers from wherever you're going. Let me ask you this. Has anybody given you a diagnosis, number one? Number two, have they told you what's causing your pain, or what we call the dominant pain producer? Did anybody even tell you, let's say that you had a disc herniation, did they say, well, this is what happened? This is what we call the mechanism of trauma. Did anybody even say that to you? Did they tell you that disc herniation started a long time ago before you bent down to pick up the pickles in the refrigerator and felt that pain and you couldn't straighten up, instability and excruciating symptoms? Did they tell you that? No, because they don't understand it. And that's the problem. And when providers who say they know about chronic pain don't, then you get glumped in with everybody and it's a one-size-fits-all treatment program. That's got to stop, because you are an individual and you have certain things that you need to be taken care of with your care plan. So let's get back why MRIs don't tell the whole story. They are really good at catching major issues, such as some kind of tumor process, a fracture, major structural damage. They're really good at that, okay? But you can't take an MRI and just automatically know the whole picture, the whole story of the patient. It's just one part of it. So what is the story? How do you build that? Well, I can tell you that if you are going to a provider, let's say that you've been in chronic pain for a long time, and you've tried all these other providers. You've tried MDs, you've tried chiropractors, physical therapists, pain management specialists, and everything. It hasn't worked. Nothing's worked. And family and friends say, oh, you got to go see this guy. This guy, he knows what he's doing. Well, I'm going to tell you really quick. You will know in the first, basically 10 minutes, if this is the right office for you. If the doctor comes walking in and starts asking you the same questions that everybody else has, like, well, when was the onset of the pain and what makes it better? What makes it worse? How would you describe it? They don't understand chronic pain. See, chronic pain, we need a different history. We need different questions. They should be asking you a lot of different things like, do you feel like you're going to get better? What's your day like? When you wake up in the morning, what happens? When do you experience the pain? What movements are you doing when that happens? Are you scared to move? Are you scared that you feel like this is never going to get better? Are you sleeping okay? Do you have anxiety? Are you feeling a little depressed about this? And if you say yes to that, it's like they should say, that's okay. That is okay, because this has been one heck of an experience for you. If they're not doing that, chances are that's not going to be the right office. What they're going to do is they're going to recommend the same treatment. It's going to be a one-size-fits-all. It's going to be what I call cookie cutter. That isn't going to get it done for you. So here's what really happens with chronic pain. You have gone beyond the normal healing properties. We talked about it in last episode. You've gone beyond the normal healing properties that you would associate with that injury. And now it's gone from being a mechanical or structural issue it's become a brain issue. Now, I want to make it perfectly clear. I'm not saying this is in your head, not at all. It is real, but your brain has taken over in a very protective manner to create a behavior of limited movement. So you start to do something, your pain has lowered the threshold for that to cause pain because it's not getting the information it needs from every place in your body up to this part of the brain that we call the sensory homunculus. I know it's a big word, but there's a map. You've got a map on each side of your head, and in that map, it represents your body. Like there is a specific spot right up in here for your low back. Well, when your low back is injured, and then over a course of time, you've gone into chronic pain syndrome, that low back representation up there gets smudged. It's called a blurry map because you're afraid to move. It hurts to move. You don't want to move. You develop abnormal movement patterns. The individual joints in your low back, they're not moving either, okay? And the muscles are the big ones. The muscles get tight and they get stiff and they get shortened, and you try to do any kind of move and it resists stretch. Well, those muscles have got to be firing. They got to fire up to the brain so the brain knows what's going on. And if they're not doing that, you get a blurry brain map. What happens when that occurs? Well, you get decreased movement. You become more deconditioned. It's a vicious cycle. You don't move, and then the brain goes, okay, stiffness. You don't move, increased stiffness. It protects it. So you become neurologically starved, neurologically malnourished. Anybody ever said that to you? I'm not talking about a pinched nerve because it's not a pinched nerve. It's your nervous system is not provided. You're down here, your peripheral nervous system is not sending the information up to your brain, and your brain goes, I'm protecting you. So the only way to bust out of this is you got to come at it from a neurological perspective. And that's what we do at Arcveld Advanced Chiropractic. We come at this from multiple directions. The first thing is, I'm not going to say you got a disc problem. Now, when you come in, I'm going to do a different history because I want to know about you. I don't want to know about, well, what's the pain like? When does it hurt? I don't want to, I kind of do, but I want to know your story. I want to know how it's affecting your life. I want to know how it's affecting your family. I got a pretty good idea because you see, I grew up in a chronic pain family. My father had 3 spinal fusions and they didn't work. He was disabled very early on in his life. And sometimes I got to tell you, it wasn't real pleasant to be around him, so it's a chronic pain family. I get that. So we got to come at this from multiple areas. First thing that we got to do is we have got to get those joints in your low back moving, but we've got to let the brain know it's safe. It's a safe technique. And that doesn't mean you go in there and you rack them and crack them like a traditional chiropractic adjustment. That isn't going to get it done. The reason PT doesn't work, because their exercises is not providing enough neurological bombardment, and I mean information to get up to the brain for the brain to raise the threshold for pain. We need to start off with Cox flexion distraction technique, a real simple, easy adjustment. It gets the joints moving. When they start moving, even a little bit, when they start moving, they're going to fire up to that sensory homunculus, and your brain's going to go, woo! And then the muscles. Okay, so when you're doing the Cox flexion distraction technique, we're stretching those stiff and tight muscles. There's a receptor in those muscles called the muscle spindle. It is big, plays an important role. So that muscle spindle is going to start firing. That's going to go right up to your brain as well. So now this knows what's going on down there. They're communicating. And again, it's going to raise the threshold for any kind of pain or discomfort. You know what else happens when we get those muscle spindles firing? It goes to a part of your brain called the cerebellum. And now we're going to start having smooth, coordinated movements. Because when you got chronic pain, you just don't feel fluid. You don't feel smooth. Fine movements start to diminish. And the other thing, your balance just sucks, okay? Because the muscle spindles in, what's the famed muscle I always talk about? The multifidus muscle, which is a spine stabilizer. And I guarantee you 99% of providers out there treating acute pain don't have a clue about the multifidus or just poo-poo it. They don't think it's anything. But if you're a chronic pain specialist, you know that the multifidus muscle is the most important muscle in your low back. It's not the core, like PTs would lead you to believe. It's not the disc, like the spinal decompression and laser providers want you to believe. It's the multifidus muscle. So the only way to turn that muscle on, get it stronger, you got to apply a direct current neurological muscular stimulation to it. Wow, that's a big word. It's a special type of electrical stimulation that goes right to those muscles, and it's like having a gym. You're getting 500 pulses per second down there, and it's doing work. It's doing a activity that's going to increase that muscle. It's going to turn it on, because that muscle has been in a bad cell coverage because of the chronicity, because of the issue. You've been deconditioned. It's gotten weak. You know how that works. You've heard the phrase, if you don't use it, you lose it. You know that your muscles get weak if you're not doing things. Well, we are going to come in, and it's the only way to do it. You can't stretch it, get it stronger. You can't use any other kind of stimulation to get it stronger. There isn't back exercises specifically for the multifidus. You got to use direct current neurological therapy, period. I've used it in my office for 5 years. The results are amazing. Actually, we see a lot of patients that have gone through spinal decompression only to have the pain return within a few months. And they don't want to go back through the whole rigmarole of all those sessions and pay thousands of dollars. We come in and we get that multifidus muscle turned on, balance restored, stability restored, movement restored, and that's the key, movement restored. And we can track that. We have, when you do an exam at our office, we use a thing called neck care. Neck care is going to measure your neck movements, and we're going to see how well you know what's going on with your neck. It's called sensory motor control. Big word, but it just says, hey, do you know what's really going on with your neck? Can you control the movements? Then we're going to come in with kinetisense. Kinetisense is it's our movement. It's like a biomechanical movement laboratory that's on my iPad. The information that it's going to give us is unbelievable. I'm going to find out exactly where the abnormal movement patterns are, where the joints are stuck, where there's instability. And now I can come in and I can be very, very targeted with my therapeutic intervention of chiropractic adjustments. And then we're going to be able to use our neuromuscular electrical stimulation, our direct current. We're going to come in and we're going to awaken those muscles that have been dormant, and then they're going to be able to do what they need to do. You know, your muscles, their main job is to absorb forces and loads. And when they can't do that, those loads or forces go somewhere. And many times they go to anatomical structures that were not designed to handle it. A disc, a ligament, a tendon. And now you start hearing these diagnoses. Well, you got bursitis. Oh, you got tendonitis. No, you don't. The itis means that there's inflammation and pain and redness. Many times I hear, oh, I've been given a diagnosis of tendonitis. Yes, there's no pain, swelling, or it's not tendonitis. It's a muscle that cannot absorb the loads or forces, and it's got to be turned back on. And we can do that. Does this sound good? Does this sound like the answer to what you've been looking for? Well, if that sounds good, how about the anxiety, the stress, maybe even the depression that you're under because you've been in chronic pain and you're almost giving up hope and you're wondering, am I going to have to live like this forever? Am I ever going to get back to normal? Can I go back to work? Am I going to be pain-free? That all plays a part. And you know what? Where the pain finally makes it up into the brain, it's right next door to your emotional center of your brain. So if somebody is not addressing what we call the autonomic nervous system dysfunction, or that you're sympathetic dominant, I don't want to get too heavy with the terms, but just know that when you're sympathetic dominant, you can't turn your brain off. You ever had those nights? Can't turn the brain off. You're just thinking, you keep thinking, you got those bad thoughts. That leads to sleep deprivation, leads to anxiety, leads to depression. Chronic pain does that. And if you don't have a provider that has a specific program for that, it's not gonna, you're gonna be stuck again. We do. We use brain tap entrainment therapy. It's great. You put on a headset and you listen to recordings. And Dr. Patrick Porter takes you to maybe to your mountaintop retreat, maybe to the beach, but he's going to get you out of that fight or flight and help you relax. We have to get relaxation in there. There's a whole bunch of sessions on just pain relief. It will open up that medicine cabinet in your own brain to take away pain. So we do a lot of things. There is hope. Hey, I don't care where you're at in the United States. I want you to contact me. So here's what you can do. I want you to take, and this is my email down there, ted@defeatingpain.org. Send me an email. Let me know if you like this. And I tell you what, if you send me an email and you say, even if you say, I don't like this, you're full of hooey. Hey, I'll send you a free ebook on low back pain. How's that sound? I'll send that to you. Okay. Now, what I want you to do, I want you to send me the email. The other thing, subscribe. Actually, you know what? Subscriptions are nice, and I know everybody on YouTube asks for them, but what I'd really want you to do, I want you to tell others about what you're watching here and see if it resonates. Because the only way we're going to defeat pain together is by letting people know. The other thing, if you're really interested in what we do at the clinic, you can take, and that's my clinic right there. You can go on the website, and we've got a lot of cool things. So I want to leave you with this message. There is hope. You do not have to remain in chronic pain. That just rhymed. Didn't even realize that. So here's what I want to end with, and I am going to end. Reach out to me, because the only thing you have to lose is the pain. See you in the next episode.